Hello and welcome to Bright Path Journey. Delving into the world of cancer, we find a myriad of complexities. Cancer affects millions of people around the world each year. This disease, characterized by the uncontrolled growth of abnormal cells, can start almost anywhere in the body and has the potential to spread, impacting not just the physical health, but also the emotional well-being of patients and their families. Different types of cancer are named after the organ or tissue they originate from, and each can uniquely influence the body's normal processes. Cancer can be triggered by a variety of factors, from genetic mutations to environmental influences, such as exposure to certain chemicals, radiation, and lifestyle choices like smoking and diet. It's important to note that cancer is not a singular disease, but rather a collection of related diseases with shared characteristics. Common forms of this disease include breast cancer, lung cancer, prostate cancer, and colorectal cancer, each presenting unique challenges and requiring specific treatment approaches. Other less common but notably aggressive cancers, such as pancreatic cancer or brain tumors, also exist. As we navigate the intricate labyrinth of cancer, one term often surfaces: metastasis. This is the process that sees cancer cells break away from their original tumor and spread to other parts of the body. Metastasis is a significant factor in cancer progression and influences the scope and effectiveness of treatment options. Cancer cells often migrate to areas like the bones, liver, lungs, and brain. The pattern of metastasis can vary depending on the type of cancer, adding another layer of complexity to understanding and treating this disease. Metastasis can bring about a host of complications, from pain to organ failure, and even additional symptoms that can drastically affect a patient's quality of life. The presence of metastasis often necessitates changes in treatment plans and can impact the overall prognosis. Despite the challenges posed by metastasis, it's not all doom and gloom. Advances in targeted therapies aim to control or reduce metastatic growth, offering hope for improved outcomes. And beyond medical treatments, there is a wealth of resources and support systems available for patients and their caregivers, underlining the importance of mental health and emotional support during treatment. In conclusion, understanding cancer and its propensity to metastasize provides insight into the complexities and challenges of this disease. It is a journey that millions embark upon each year, armed with knowledge, resilience, and the unwavering hope for a cancer-free future. Remember, knowledge is power, and understanding the intricacies of cancer is a step towards combating it more effectively. To fully comprehend the nature of cancer, it's essential to delve deeper into the mechanisms behind metastasis and the concept of cancer remission. Metastasis, a complex process, happens when cancer cells have the ability to break away from the original tumor. These cells then travel through either the bloodstream or the lymphatic system, and eventually form new tumors in different parts of the body. This phenomenon is influenced by various factors, including the specific type of cancer, its stage of development, and the patient's overall health. On the other side of the spectrum, we have cancer remission. Remission in the context of cancer refers to the reduction or complete disappearance of signs and symptoms associated with the disease. It can be partial, where some but not all signs and symptoms disappear, or can be complete, where all signs and symptoms vanish. However, it is fundamental to remember that remission does not necessarily to the cancer being cured. By understanding these intricate aspects, it becomes possible to manage the disease more effectively and instill hope among patients and their caregivers. In our quest to understand cancer more deeply, we can't overlook the concept of metastatic recurrence. Metastatic recurrence refers to the reemergence of cancer in areas where it had previously spread and was believed to have been treated successfully. This is a significant concern in the management of cancer, and it can occur months or even years after the initial treatment. The likelihood of metastatic recurrence is influenced by a myriad of factors. These include the type of cancer, the stage it was at when first diagnosed, and the effectiveness of the initial treatment. There's no denying that metastatic recurrence presents a formidable challenge, but it's a challenge that the medical community continues to tackle head-on. Through ongoing research, improved treatments, and comprehensive patient care, we strive to turn the tide against metastatic recurrence. As we journey through the complexity of cancer, understanding the potential for recurrence is a critical part of the process. With knowledge, we can foster hope, and with hope, we can continue the fight against cancer. Thank you for joining Bright Path Journey as we explored the difficult yet important topic of cancer metastasis. While it's a subject that brings many challenges, understanding the mechanisms and effects of metastasis can empower patients and families to navigate cancer treatment with greater awareness and preparedness. If this video helped in any way, please consider sharing it with others who might benefit from this information. Don't forget to like, subscribe, and click the bell icon to stay updated with our latest content, designed to inform and support you through life's challenges.